your blood sugar levels, your cholesterol levels, your blood pressure. And if that is in what they deemed to be a normal range, then they think you are healthy. And I look at that as, I call it small health.
Small health.
Small health. This is the mechanical aspects of health, is like your body as a machine. That's only a very small, for me, a small aspect of health.
Right.
I look at health in a different way, and I call it big health.
Big health.
Big health is different. Big health is a term that was introduced by a German philosopher, Friedrich Nietzsche. Big health includes small health, but adds another dimension to it. Adds the dimension of meaning and purpose. Maybe the best way of explaining it would be to share an example.
Great, great.
So, just last week I worked with someone in Ireland over the phone. She read my book and got interested and contacted me and said she wanted to work on her symptoms because she had a few symptoms that scared her.
Body symptoms.
Body symptoms. So I asked her about her body experience, and she said she had several small strokes. They were small and not long-lasting, so she recovered pretty well, but they really scared her.
Right.
Because she's afraid of getting a big stroke or something that is more consequential. So I asked her how she experienced these strokes, these small strokes. And she said, well, it's like something, I got blank, I got spaced out, and my brain didn't work at all anymore. I was like totally altered, I couldn't function, and I was almost a little bit off balance. So I said, well, why not play around with that experience and do that together? She was on Skype, she was in Ireland, I was on the phone, but we said that she laid them backwards and went just blank, and went in that altered state and totally relaxed, and said, oh, this is such a great experience, and I helped her go deeper into that and then bring that experience back into her life. And especially what came out, how to be like that in relationship.
What did she find?
She found that it's because she grew up having to take care of her mother. Her mother was very demanding and she was very scared and needed really a lot of attention. So as a child she really grew up taking care of the mother and then grew up becoming actually a doctor herself. Becoming a naturopath or homeopath, and was always taking care of people. Now her stroke, or her small strokes or mini strokes, help her detach from that very related identity and become much more unrelated or spaced out or taking care of her own self and just dream and go into this space of blankness or empty space that she uncovered in her stroke. So that is how the body is dreaming. It's coming, it's bringing up something meaningful that is really can help the person actually become more whole. And big health includes small health, so it's really important for me to help her take care of whatever she needs to do to prevent any other strokes. Making the definition of health so narrow to what is normal or what should be normal, and often is also associated with being young, being slender, and not having any chronic health issues. And in that way, with that narrow definition of health, we exclude a lot of people from thinking that they are healthy, or we exclude them, and we put them in a marginalized position, which in itself creates more distress. I remember one time we worked with someone on her really severe migraine headaches. And all her experience, a lot of her strength and power was restrained back, and it came out as a symptom, and we helped her really identify with that strength and power that she has to become much more outgoing and active as a woman, and stronger, because she had certain ideas of how she could use her power.
Wow.
And then we looked at, as a group, how we as a community repress our own strengths and powers, and how that is sometimes related to gender issues, and how women have different ways of expressing their strengths, and how sometimes the mainstream culture oppresses some of the strengths and powers of women, and that became a whole discussion and forum and debate in the group, which actually was very relieving also to the individual with the migraine. We are part of making, well, this is, I'm shy to say it, but we are part of creating health issues and health problems in other people.